Stop what you're doing. If you're over 65 and you have back pain, this video could save your life. Here's a fact most doctors never share with patients your age. Over 37 million Americans have kidney disease right now. Most of them have no idea. And the number one sign they missed? Back pain. Dull. Nagging. Right here. In the lower back or just below the ribs. They called it old age. They blamed the mattress. They took ibuprofen and moved on. Some of them waited too long. Here's what I want you to know today. Back pain after 65 is not always wear and tear. Sometimes it is your kidneys sending you a warning signal, one you absolutely cannot afford to ignore. If you've ever felt a deep ache in your lower back that pain cream just won't touch, comment the word yes below right now. Stay with me through this entire video, because by the end, you'll know exactly what to look for, what to do, and when to call your doctor today. A few years ago, a 71-year-old woman came to see her physician. She had lived with lower back pain for 2 years. 2 full years. Her family told her it was arthritis. Her pharmacist recommended heating pads. Even her doctor ordered an x-ray of her spine. The x-ray looked normal, but her kidneys were silently failing. By the time they found it, her kidney function had dropped by nearly 40%. This story is not rare. It is happening every single day to people your age, in your city, in your neighborhood. That is why this video exists. Today I'm walking you through 7 warning signs that your back pain may be kidney-related, not age-related. Stay with me until the end, because point number 6 will genuinely surprise most people watching. Let's get into it. 1. Not all back pain is the same. Muscle and spine pain usually sits in the very center of your lower back. It gets worse when you move. It feels better when you rest. Kidney pain is different, and knowing the difference could change everything. Kidney pain typically lives on one side of the back. It sits just below your rib cage, slightly off-center. Sometimes it radiates around to the front, toward your abdomen or groin. Here's a simple way to think about it. Press your fist gently against the area just below your right or left rib, in the back. If there's a dull, deep tenderness there, that is not a muscle. That is not a disc. That is your kidney's neighborhood. And if that tenderness showed up without any injury, without lifting anything heavy, without any clear reason, pay attention. This one distinction alone is worth writing down. 2. This is uncomfortable to talk about, but it is too important to skip. Your kidneys filter your blood. Every single minute of every day, they are quietly cleaning your body. When they struggle, the first thing that changes is often your urine. Watch for these specific changes. Foamy or bubbly urine. That can mean protein is leaking through. Urine that is darker than usual. Tea-colored or brownish. Needing to urinate far more often, especially at night. Or the opposite, urinating far less than normal. These are not embarrassing quirks. These are your kidneys raising their hand and asking for help. If you've noticed any of these changes alongside back pain, do not wait for your next routine checkup. Call your doctor this week. Ask for a simple urine test called a urinalysis. It costs almost nothing. It takes minutes. And it can catch kidney trouble early when it's still very treatable. 3. Many people over 65 accept swollen ankles as simply part of getting older. Sometimes that's true, but sometimes it is a warning sign of kidney trouble, and it gets overlooked every single day. Here's why it happens. When your kidneys aren't filtering properly, excess fluid builds up in your body. That fluid sinks to your ankles, your feet, even your legs. If you press your thumb into your ankle and the indentation stays for a few seconds, that is called pitting edema. And combined with back pain, it deserves medical attention immediately. Don't brush this off. Don't buy compression socks and call it done. Get checked. Drop a number 3 in the comments if swollen ankles have been bothering you lately. 4. You went to bed at 9 p.m. You slept 8 hours. You woke up exhausted. Sound familiar? This kind of fatigue, the bone-deep kind that rest doesn't cure, is one of the most underreported symptoms of kidney dysfunction in older adults. Here is the science in simple terms. Healthy kidneys produce a hormone called EPO, erythropoietin. That hormone tells your body to make red blood cells. Red blood cells carry oxygen everywhere. When your kidneys struggle, EPO drops. Red blood cells drop. Oxygen to your muscles and brain drops. The result? You feel wiped out. All the time. For no clear reason. Doctors often label this fatigue of aging. Sometimes it is. But combined with back pain, combined with any of the other signs in this video, it deserves a closer look. Ask your doctor for a simple blood test called a BMP or CMP, Basic or Comprehensive Metabolic Panel. It checks kidney function directly. Most insurance covers it fully. 5. Are you on blood pressure medication, but your numbers are still high? This is more important than most people realize. The kidneys and blood pressure are locked together in a two-way relationship. High blood pressure damages kidneys over time, and damaged kidneys cause high blood pressure. It becomes a cycle, and it silently destroys kidney tissue year after year. For many people over 65, poorly controlled blood pressure despite medication is the very first sign that the kidneys are involved. If your doctor has been adjusting your blood pressure medicine frequently, if it keeps climbing back up, bring up your kidneys directly. Say these exact words. I like my kidney function checked, my GFR and creatinine levels. Those are the two key numbers. GFR, glomerular filtration rate, tells you how well your kidneys are filtering. Creatinine tells you how much waste is building up in your blood. You have the right to ask for these tests. Ask clearly. Write it down before your appointment. Drop a number 5 in the comments if your blood pressure has been hard to control. Before we go further, I need to tell you something. We have covered 5 important signs so far. But point number 6, coming up next, is something that surprises almost everyone who hears it. It is a symptom that gets dismissed, misdiagnosed, and laughed off constantly. And for people over 65, it may be the most important warning sign of all. Stay right here. Do not click away. We are almost there. 6. When kidney function declines, waste products called uremic toxins begin to build up in your blood. Your body hasn't asked for them. It can't get rid of them fast enough. And they affect your brain, your stomach, even your taste buds. Many people with kidney trouble report a strange metallic or ammonia-like taste, especially in the morning. Food starts to taste wrong. Appetite fades. Nausea arrives without any clear cause. Most people blame this on their medications, or acid reflux, or just getting older. Their doctors often agree, without ordering a kidney test. But here is what the research actually says. A study published in the American Journal of Kidney Diseases found that over 60% of patients with moderate kidney disease reported appetite changes and taste disturbances, often for years before diagnosis. Years. If you or someone you love has been dealing with unexplained nausea, skipping meals, or a strange taste that won't go away, please bring this up with a doctor and ask specifically about kidney function. It is not in your head. It is in your blood work, waiting to be found. 7. Your skin itches, but there is no rash, no bug bite, no dry patch you can point to, just a persistent, maddening itch, often on the back, arms, or legs. Here's why it happens. When kidneys can't remove phosphorus and other minerals from the blood, those minerals build up, they deposit under the skin, and they cause deep, relentless itching that no lotion can touch. This is called uremic pruritus. It affects up to 40% of people with declining kidney function, and it is almost never connected to kidneys by the person experiencing it. If this is you, tell your doctor. Specifically mention that the itch has no visible skin cause. Ask for a phosphorus level check alongside your kidney panel. Drop a number 7 if you've had unexplained itching that's been driving you crazy. Let me bring this together for you. Kidney pain feels different from back pain. It lives below the ribs, often on one side, and doesn't respond to muscle treatments. Changes in your urine, foam color, or frequency, combined with back pain, deserve a urine test this week. Fatigue, swelling, high blood pressure, nausea, metallic taste, and unexplained itching are all signs your kidneys may be asking for help. Here is what I want you to do right now. Write down these 3 words on a piece of paper. GFR, creatinine, urinalysis. Take that paper to your next doctor's appointment. Hand it to your doctor. Ask for these tests. That is it. That simple act could catch something early, when it is still very manageable, when treatment is still easy, when you still have time. You have spent decades taking care of everyone else. It is time to take care of you. If this video helped you, please hit the like button right now. It takes 1 second, and it helps this information reach more people who need it. Subscribe so you never miss a video like this. And most importantly, share this with someone over 65 who has been living with back pain. You might be sharing more than a video. You might be sharing a second chance. Leave a comment below. Tell me, which of these 7 signs surprised you the most?